Kevin Hunter here on the Business Forum Show, and my special guest is David Kennedy from Kennedy Vision. And you can find him on the web at kennedyvision.com, and the office number is 763-545-8850. And we'll come back to that in just a moment. Well, first of all, welcome to the show, David.
Thank you.
And talk to us a little bit about your eye clinic. You've had this for a lot of years, 1974.
Yeah, I was only 12 at the time when we started, but...
You were 12. Was this a family business?
No.
Oh.
Yeah, that's when we started, right out of right out of college, partner and I.
So you were just trying to be funny saying you were 12?
Yes,
Yes,
I was.
okay.
I don't like to be the old guy.
Yeah, okay.
And started from scratch, from cold, and in the town of Plymouth. Very good to us. We did grow, slowly at first, but kept growing, and had to move to 3 different locations to keep up with the growth. Town has been very good to us. So we decided a few years ago to put a practice in Elk River, and that's done very well too. We just had to move to a new location. So yeah, we have 19 staff now, and growing every day. So we get those growing pains that all businesses get as they grow, but those are good headaches.
Yeah.
And we continue to grow. Excellent.
Well, one of the things I want to go back to a little bit, you noted here some of the bad economy times. So, and some people aren't aware of the fact of how much it cost to borrow money years ago to grow your business. Talk about that a little bit, because some of these statistics you have shared here are quite staggering. And when people think about, even though the economy isn't the greatest at the moment, we've been making a recovery from the difficulties of 2008, 2009, 2010. Borrowing money today was much easier back than when you were starting your business, and even when you made some of your moves. So talk about that a little bit.
When we started in 74, the interest rate, the best we could get was 18%, and we had to work to get 18%.
Yeah.
Then when we relocated down the highway just a little ways, in the early 80s, it was 22% interest that we had to pay. And then we relocated in Plymouth in 08, which wasn't the best economy. But fortunately, we were able to get financing. The business was doing well enough that it was a little easier to get at that time.
Sure.
So, and I think just the economy in general, with a business that's trying to grow, you need to kind of understand what's happening. And our economy has been unpredictable. So it's hard to decide if you want to expand or not, if you want to reinvest the money when you really don't know what's happening in healthcare.
Sure.
So we've gone ahead and done it, but you just have to guess and hope that you're doing the right thing.
Now, in your field, a lot of people have talked about the difficulties of the recent recession that we went through. What type of pains are felt in an eye clinic during situations like that?
Well, a lot of our patients who had jobs now don't. Most of them still realize the importance of eye care, so they come in, but the spending is not like it used to be. Some of them don't have insurance anymore, or their insurance doesn't cover what it used to. So we've really had to work on getting more patients, being fair to those that come in, trying to be able to help everyone.
Sure.
So I'm sure it's been tough on all businesses, but we've certainly noticed it.
Talk about some of the changes in technology, because there's so many advancements that happen out there. And you mentioned about, I told you before the show here that I had LASIK a number of years ago, and you even mentioned about some of the things that are changing there. But how have advancements of technology changed your business? You've had this for quite some time. You've had to have seen a lot of changes.
One of the things we've always done is try to stay up with technology, and that's not easy when the economy is not great. But that's been our big advantage. I think that's why we've done well when some offices have not. Yeah, LASIK's a good example. It's much better now than it was several years ago, much more accurate. We have a machine called OCT, which actually is more accurate than an MRI in evaluating the layers of the retina and the eye. So we can pick up glaucoma way earlier than we used to with visual fields, about 6.5 years earlier than a visual field would detect glaucoma. Macular degeneration, age-related, That's much more detectable now than it used to be, much earlier stage. In fact, we have some things that will slow it down. We don't have a cure, but we can at least slow it down a little bit. So it's nice to detect it very early. Yeah, it's really thrilling. It's really exciting. I'm supposed to be thinking about retiring, and I don't want to. This is too much fun now.
Yeah.
The new technology's made the doctors look a whole lot smarter.
Sure.
The new methods for treating like glaucoma, we can pick it up earlier. The methods and medications we have, surgical procedures, way better than they used to be. So 1 out of 7 blind people in the United States are blind from glaucoma. That's a shame. You don't need to go blind from glaucoma anymore if you just know you have it. Unfortunately, there are no symptoms. So if you aren't testing for it, you don't know if you have it.
Yeah, that was one of my questions. I was thinking about as you were talking about that. So there really, other than going in for an eye exam and getting some professional help, there really is no indication to the individual that they're suffering from it.
Right.
Wow.
Right.
That's incredible. And you noted here that going blind is the greatest fear people have with growing older. And glaucoma is responsible for what percentage?
1 out of 7 blind people.
That's pretty incredible.
Yeah.
Pretty incredible. So what advice would you give yourself if, seeing where things have come today with your business, and if you could rewind the clock, what advice would you give yourself starting out of the gate?
I think we would have started right out more with eye health, educating people on nutrition, how to protect their eyes, wearing sunglasses, stop smoking. Smoking's very bad for the health of the eyes. We probably would have started with that. We just didn't know. Nobody knew back when we first started. They weren't even sure that sunglasses had anything to do with age-related macular degeneration. Now we're positive. So that's probably what we would have done. And we did take that route, but maybe not as early as I wish we had.
Is there a wrong kind of sunglasses to be wearing?
There are what I call pretend sunglasses that look like sunglasses, made in China, of course, and they're not. They don't protect you. So, yeah, it is important to wear the right type.
So getting some good advice and getting regular eye checkups is important to maintaining some eye health. My special guest here is David Kennedy from Kennedy Vision Center, and you can find him online, kennedyvision.com. Again, the website, kennedyvision.com. And you can also call the office at 763-545-8850. Again, 763-545-8850. Again, Kevin Hunter here on the Business Forum Show. My guest is David Kennedy. Thanks for listening.